We've heard plenty of ideas on what needs to be done to improve the well-being of those living with diabetes. These have been fascinating conversations. So how do we translate this into action at the federal level? To get answers, we're going to turn now to our final guests of this hour, the co-chairs of the House Diabetes Caucus. Congresswoman Diana DeGette was the author of the 21st Century Cures Act. Everyone lauds her for that. It's like super big, super famous, and super important. So kudos to the Congresswoman for that important act. And she played a role in crafting the Affordable Care Act. In addition to co-chairing the Diabetes Caucus, Congressman Tom Reed is the co-chair of the Problem Solvers Caucus. I just mentioned it earlier. I kind of gave two doctors out there and I called them the problem-solving doctors out there that are solving some of this. And Tom is a member of the House Ways and Means Committee. Both members have been focused on the health of their constituents as the coronavirus pandemic continues to upturn lives. Welcome to both of you. We've been having a very rich conversation. Let me just start with both of you. I want to ask you a simple question because sometimes people get forgotten in these kinds of conversations as we talk about, all the gadgets, all the things that are out there. But Diana, Congresswoman DeGette and then Congressman Reed, let me ask you, why is this topic important to you? Who do you interact with in your constituency that's helped define your experience on what we need to do on diabetes?
Well, I have a daughter. I'm having some technical problems here. Let's start with Tom, and I can see if we can get glitches out.
All right, Tom?
I'm learning how to hit the mute button like everyone else. That's the talk of the day. Well, I'm glad to be here, first of all, with my co-chair of the Diabetes Caucus, Diana DeGette. I will tell you, her and I come at this issue from a very personal perspective, to be honest with you. I know her daughter is a type 1 diabetic. My son is a type 1 diabetic, diagnosed at the age of 4 and now 20. And I'll just tell you, we walked very similar paths to the millions of Americans that are living with this disease on a day-to-day basis. And on top of that personal experience of having to hold your son in the emergency room when he's first diagnosed and he's crying in your arms saying, "Why are you letting the doctors hurt me, Daddy? Why aren't you helping me?" And I'm like, "No, we are helping you." And we're going through that process. But we have these personal experiences on top of the organizations like JDRF, the American Diabetes Association, who do great work across this country in regards to educating and raising awareness on the issue of diabetic care in America. And by working together, I mean, kudos to Diana. She led the charge on this. And from my side on the aisle, I couldn't ask for a better partner than Diana DeGette in regards to these issues. And, we do things like the Special Diabetes Program. And I'll just tell you, it's a huge benefit for millions of Americans. So, Diana, please, I'll turn it back over to you.
Thank you. Diana?
Yeah. Thank you. I hope I don't freeze up. I just want to say Tom's and my experience is the same. We both have kids diagnosed at the exact same type 1 diabetes. The Diabetes Caucus is the largest caucus in the U.S. Congress. And the reason is because virtually every family has been touched by diabetes, either type 1 or type 2. That's why it's been so important to do the Special Diabetes Program to really get the funding for research and ultimately a cure.
Well, let me just ask you both, and we'll start with you, Tom. As I understand it, telemedicine, telehealth at this moment, in fact, two of our participants today said if there is any silver lining in this awful, awful time, it's our experience in kind of walking into a new world where telemedicine and telehealth is part of that. We've heard about, I think, continuous glucose monitors and whatnot, and the payment of those. And we've had a kind of liberalization of the payment. There's concern that might be rolled back and might be falling back already in some of the insurers that are covering it. So, Tom, why, given the significance of diabetes, given the significance of the time here, are we worried about a fragility of the collapse of payment on the payments front?
Well, yeah, first of all, I would agree. One of the silver linings of the COVID-19, I'm a very optimistic person by my wiring, is the issue of telemedicine. And I will tell you that I think there's a great push. We in the Ways and Means Committee, and now Diana from Energy and Commerce, have been looking at telehealth for years, and there just wasn't this willingness to accept it. But I think this crisis has sent the message to all of America that, telemedicine is a thing of the present. It is not a thing of the future, and it will be with us going forward. And we're seeing, like in our committee, we propose permanency to these telehealth provisions, especially when it comes to diabetic care and also audio access, not just video and audio. And so I think you're going to see that comes out of this policies that are going to help diabetic patients as well as other patients when it comes to access to care using technology.
Representative DeGette?
Yeah, I agree. We've been trying to work on telehealth for years, and there have been a variety of barriers as well as just inertia. And so I do think that the COVID crisis has helped push us in that direction. And in some of our early bills, the CARES Act and others, we've put money towards telehealth. Now, Fred Upton and I are drafting our next CURES bill, CURES 2.0, and we're hoping we can really use this as a jumpstart for telemedicine.
What are the kinds of elements in this time of the COVID crisis that are, that we're seeing the disproportionate impact on this on vulnerable communities, elderly communities, communities of color? And part of that question is, how do we get coverage and some of it's financial support and inclusion? So Congressman Reed, how do you think Medicaid expansion or other elements of this inclusion picture of getting, so I'll tell you, Dr. Robert Redfield, I interviewed him the other day, and he said, Steve, we're going to have to find a way to eventually, with COVID, for instance, a homeless person is going to have that, no resources, no options, and we're going to have to provide housing for that person and care for that person in a humane way. And so I'm just interested in, does Congress have the literacy and the awareness of these issues, do you feel, on the coverage challenge?
In my opinion, obviously, I think both sides of the aisle recognize that healthcare is a critical issue that has to be addressed in America. Now, obviously, the debate on healthcare. There's two different schools of two different ideologies on it, but I think there's a lot of common ground, especially when it comes to the Medicare population. Obviously, being on Ways and Means, we spend a lot of time there, and I know Medicaid is a jurisdiction of Energy and Commerce, and the folks like Fred Upton and Diana DeGette. But I think people have a common bond that they recognize people should have access to healthcare, that they should have affordable healthcare, cheaper costs, out-of-pocket exposures. And how can we do that? And how can we align? This is where Diana and I came together in regards to the Diabetes Caucus. We did a 2-year expose on the issue of pharmacy benefit management companies and aligning the interests and how the disincentives are misaligned in regards to keeping costs down. The actual incentives are to drive the cost up. And so by bringing that transparency and sunlight, I think we're going down the path of holding these entities accountable to really align the interests and make sure the incentives are to have affordable healthcare as the outcome, as opposed to what we see today.
Is Representative DeGette back with us? Okay, let me ask Congressman Reed another question. On, you co-chair the Problem Solvers Caucus, and I was not joking when I said I'm very grateful for what you do. It's nice to have somebody out there kind of working across the aisle, seeing what can be done. I don't know if Fred Upton is on it, but Fred was saying good things about Diana DeGette the other day, so you sort of feel like there's, wow, people are being very nice across the aisle. But in the Problem Solvers Caucus, how high are these healthcare questions in their priority list? I know there's a lot out there, but what is the priority of something like diabetes during the COVID threat, coverage, new technologies? Does it rank highly, or do you have to really fight for it to get up there?
No, it's pretty well recognized. Healthcare is a priority in America today. Everyone agrees that the present system is not working. It is not producing optimum results, and that we have to address this issue. And so in the Problem Solvers Caucus, that group we founded, and Fred Upton is a member of the Problem Solvers Caucus, that 25 Democrats, 25 Republicans that I co-chair on the Republican side that are committed to working together. When we get to a consensus, we'll vote as a block. We will agree not to campaign against each other. So we develop a real trusting relationship across the aisle and communicate with each other on these issues. And one of the common conversations is, what can we do on healthcare? And after the famous John McCain evening, where he voted against the passage of the bill in the Senate, the caucus itself mobilized and said, we need to take on this issue. And we put together some reforms to try to see where we could find common ground. We put a whole package together, the only bipartisan package on the issue of healthcare that came out of that Congress. And I'll just tell you, there's a commonality because there's not a human being that has not had a healthcare issue that's impacted a loved one, a family member, or somebody down the street that's a stranger. And so we do spend a lot of time on these issues. But the fundamental question is, how do you solve this? Do you solve it with government mandate, or do you solve it with transparency, accountability, and trying to align the interests and bring market pressure to keep these costs under control? But in the meantime of that conversation, you can actually find a lot of common ground if you work at it.
We were just talking to Dr. Ann Peters at USC, and she's both on the clinical treatment side, but she's also kind of a theoretician, an academic on this. And we were fascinated to talk to her because she was talking about having all the tools she needed now to reach folks, and that there were lots of new products, new tools, new medicines that had come into play. Her challenge is reaching the right populations. But I'm interested in that former thing of technology and how it's come in to change the game. And I'm sure you're watching this on behalf of your son and other constituents and people that are out there. But from your perspective, because you're at this in a more daily way than I am, what are some of the new technology possibilities and prospects? And what can the broader public do, or what can Congress do to be more supportive of that innovation?
So this is where common ground items come together. So making sure that the red tape doesn't over the bureaucracy of things that the 21st Century Cures and others have put forward, to make sure that there's processes in place to get these products, to get this technology through the system, out into the marketplace, out into the healthcare environment. And you look at things like the continuous glucose monitor. That technology is mind-blowing, and how it's evolved over the last 15 years in the term that my son had type 1 has had diabetes since he was 4. And you see what has happened with the insulin pumps and continuous glucose monitoring. I was glad to work through the administration over into the on the regulatory side to get that covered by Medicare, and so that you have CGM access for our senior population. And I would just tell you, the numbers when it comes to A1Cs, 3 numbers, and the management of the disease by technology like continuous glucose monitors are night and day. But we have a lot more work to do. The artificial pancreas, that is something that is right around the system. We got these closed loop systems now. The technology and innovation in diabetic care has grown leaps and bounds, and each and every day we're getting closer to that ultimate solution, which is the cure.
I don't know if Congresswoman is back with us yet, but we do have a question from the audience. But I just want to, make my own editorial comment in this. Is, I've never been in a time where we've seen such incredible leaps in technology and possibility that are really, truly game-changing. From genetic editing to all sorts of other dimensions of tackling disease at a time where it always feels like the system, from a financial and economic perspective, is near collapse. So, I love the way you just framed it. But we have a question from Jessica. Jessica?
Hi, my name's Jessica Lynn Lato. I'm from Charlotte, North Carolina, and I'm a volunteer with the Diabetes Patient Advocacy Coalition. Today I have a question for Representatives DeGette and Reed. As a person living with type 1 diabetes and as someone who's lost a loved one to insulin rationing, the issue of insulin affordability is very near and dear to my heart. I appreciate the work both of you have done on this issue, particularly with the introduction of the Insulin Price Reduction Act last year. And I'm curious to know what the status of that legislation is. Thank you.
So the insulin question.
Did Diana come back? I don't want to take up all the time.
I think she's trying, but we're going to just proceed with you, and we have the spirit of Diana DeGette with us. So, Tom Reed.
Her spirit is very helpful. I can tell you that. I rely on her heavily. We're making some very good headway in regards to that, and what we're really trying to do. And we were real close before COVID-19. Diana and I were working with our Senate partners. Susan Collins on our side of the aisle over there has been a very great friend to me in regards to pushing this as a priority through the Senate. And I'll tell you, we were so close. And then all of a sudden, the COVID-19 situation occurred, and everything obviously got reprioritized and kind of put it on a back burner as we speak. Now, we're still hopeful. The foundational work, all the legislative groundwork from bicameral relationships from the Senate and the House working together. So when we get an opportunity, I think there is going to be a vehicle, in my humble opinion, that this will ride along in regards to taking on the healthcare issue when the healthcare issues get addressed in an independent bill. And so we've been working with Senator Lamar Alexander and others in regards to and Chuck Grassley, because those are the two key individuals over in the Senate on these healthcare provisions that are leading some charges in regards to healthcare legislative vehicles. But we have done, and there's broad agreement on what Diana and I put together in regards to the insulin bill. And I'm very confident once we get through COVID-19 that the next healthcare bill will have that included in it.
Well, thank you. Just before we end, Congressman, and thank you so much for your time today. You know, one of the questions that it comes up, when I hear questions about costs of healthcare and medicines and whatnot, is one of the things I've painfully learned after doing hundreds of healthcare forums is there's a big ecosystem. There are providers, there are PBMs, there are some that negotiate it, there are insurance companies, there are drug manufacturers, the generics, biosimilars. You can kind of get it. And we did a conference not too long ago on reimagining healthcare and tried to bring a lot of these folks to kind of look at the ecosystem, because sometimes people are looking for a silver bullet and not understanding the synergy of these different groups. Is that something that you and your Problem Solvers Caucus is looking at? Because when you talk about the price of healthcare out there, there's so many drivers of that. And I am genuinely editorially interested in how you untangle it, because I can't find either one hero or one villain to blame. It's a complex game.
Steve, you articulated it so well. And as we get into these healthcare issues, how I try to think about it is there's two main ecosystems that I kind of focus on. You have health insurance and the marketplace that is the domain of the health insurance area. And then you have the health care area, which has the market domain there. And both have their independent interests, their independent incentives and disincentives. And what I humbly believe is that if you take on those separately and you try to align the interests in each one, you have a better shot of getting a good outcome, which is lower health insurance for everyone, so the costs are down and affordable. But at the same time, you have lower health care costs so that the premiums of the health insurance can correspondingly remain low. And if you align the interests appropriately, I think we can get there. And it's all about transparency. It's all about accountability. And the idea that you can, and government has a role here to be a referee and to create that type of environment, but you have to have that pressure of those ecosystems, else you're going to get an artificial or just maybe a feel-good type of, we issued a mandate, and if the mandate is not come with solutions, you can have the best legislative mandate, but you'll never get an outcome that works for people on a day-to-day basis. So I believe there's a winning combination there, but I really fundamentally keep them in those two silos in my own simple mind.
Well, Representative Tom Reed, and also in absentia, Representative Diana DeGette, we really appreciate your time and thoughtfulness on this, and I hope you'll come back, because I don't think this is a kind of one-and-done issue. We're going to be back discussing it for a long time.
And Steve, one of the huge opportunities on the issue of health insurance costs and health care costs is innovation. Never lose sight of the power of innovation. And I will just tell you, I appreciate the opportunity with you. And to have a colleague like Diana DeGette truly is a committed legislator to her people that she represents, but most importantly, a good partner in regards to taking on the issues of diabetic care in America.
Well, thank you so much, sir, and we'll look forward to talking with you again. Thank you. And keep up the great work. That brings us to the end of our program today. A big thank you to the National Diabetes Volunteer Leadership Council and Diabetes Patient Advocacy Coalition for their support, and to all of you attendees for joining us for this very important discussion. I want to thank those people who also asked such great questions. And for those of you who missed any of the conversations this afternoon, we're going to have our video up from the event on our website shortly. I'm Steve Clemons. Be well.